Welcome to today's Ethnic Media Services California Black Media Zoom News Conference. I'm Pilar Marrero, Associate Editor of Ethnic Media Services and your moderator for today's briefing. Today, our focus is on Medi-Cal's impact almost a year after redetermination of members' eligibility began, and how those who lost healthcare but are still eligible can renew coverage. We thank the California Department of Healthcare Services for their support for today's news conference. A year ago, DHCS launched a federally mandated annual initiative to redetermine Medicaid eligibility. Medicaid, as you know, called Medi-Cal in California. At a time when many other states were using what was called the Great Unwinding to purge their Medicaid lists, California's goal has been to keep as many people enrolled as possible and to dramatically expand Medi-Cal's reach. At this briefing, a DHCS expert will share the data on Medi-Cal enrollment numbers and plans for Medi-Cal moving forward. We will hear from a speaker at a major healthcare clinic in LA County, which has the most Medi-Cal enrollees in California, about how they are assisting eligible recipients to stay on Medi-Cal and enrolling new people as Medi-Cal expands access to all eligible undocumented residents. We will also hear from 3 Medi-Cal enrollees about the importance of Medi-Cal to their families. Our distinguished lineup today includes Jinjia Wang, Assistant Deputy Director, Healthcare Benefits and Eligibility at the California Department of Healthcare Services. Vilma Champion, Director of Managed Care and Enrollment at the Northeast Valley Health Corporation. Griselda, a Medi-Cal employee. Fitzgerald Graves, a Medi-Cal enrollee, African American Network of Kern County, and Nara Montejo, daughter of newly enrolled undocumented mother. We ask speakers to speak slowly for our interpreters in Spanish, Mandarin, and Korean, and we ask reporters to enter questions in the chat, which we will address in the last 15 minutes of today's briefing. Actually, we're going to answer questions after each speaker this time. Our speakers are also encouraged to answer questions in the chat throughout the conference. We will send a video of today's briefing and expanded bios with contact information for each speaker to all participants later today. We begin with Jinjia Huang at DHCS, who was a valued source for our briefings on both vaccine campaigns and Medi-Cal redetermination. Ms. Huang, please go ahead.
Thank you, Pilar, for the warm introduction. Good morning, everyone. I'm Yingzhe, back again to share the latest on the Medi-Cal continuous coverage unwinding. Currently, we're in April of 2024, and as Pilar was sharing, we started our work about a year ago, briefing all of you on our plans for the unwinding work. April of 2024 marks month 11, and we are ending officially the unwinding work in May of 2024. Just for as a reminder, the unwinding is super important. It is one of the biggest healthcare events after the Affordable Care Act, and California was able to renew and is continuing to renew close to 15 million Medi-Cal members across the state. Month 11 and 12 will be the last 2 months of the unwinding. And I'm happy to share California has learned quite a bit through the unwinding. In December, we were able to take up additional federal flexibilities to really help California, our members, go through the Medi-Cal renewal process much easier. And the systems that we were able to use, many of you may know this as like the Benefits Cal, coverca.com, where our members go and actually do and process the online renewals online. We were able to automate a lot of those policies in the system so that it's more streamlined for our members and more efficient. We were able to go November, we had about a 21% disenrollment rate in Medi-Cal. Every month we renew about over 1 million individuals. So about 20% of the million each month we were disenrolling from the program because of just their not being able to return their yellow envelopes, which is the renewal packets to the counties for processing, or they weren't eligible at all. But in December, what we were able to do was we automated a lot of those things in the computer systems that really helped to streamline the processes. And we were able to reduce that 20% disenrollment rate in the Medi-Cal program to about 9% in December. In January and February, the data that we have online continues to show that our disenrollment rate in Medi-Cal continues to decrease with all the automation in place. As we are looking forward to kind of the next steps of the unwinding, which I'll share in my remarks a little later, we have learned a lot of processes and systems work that help our members go through the renewals process. We know it's a very complex process many times through the renewal process to understand how to actually fill out a renewal packet, etc. We have published quite a few videos. Just a new income video has been posted to share a little bit across our provider community as well as our member community, as well as our any of our consumer advocates out in the field that's helping our members. We really want to sustain those gains because we want to make sure our outreach continues in perpetuity. In addition, in January, we were able to implement the undocumented expansion, individuals ages 26 through 49 years old, completing a kind of the Health for All full scope Medi-Cal for every member, qualified individual in the Medi-Cal program, regardless of immigration status. We were transitioning about 700,000 individuals from limited benefits to full scope benefits. And we did all that as we were going through the redeterminations unwinding process. So very happy to report that, and the department will be ready to share some additional data on this in the upcoming months, but very proud of where we are. So I'm going to turn it back over to Pilar. Thank you. Pilar, you may be on mute.
Yeah, sorry about that. Okay, I thought you were going to take a lot longer than that. Can you share with us what were some of the major obstacles that people were finding? Some of the major things that you learned when you started facing this number of 21% back in when the program started.
Yeah, absolutely. Some of the major obstacles was filling out the very hefty, it's a very thick redeterminations packet. Many of our members who came onto the program during the pandemic were new because they never had to do a redeterminations before. The Medi-Cal redetermination is an annual process and an annual requirement, but it was stopped and paused because of the federal policies under COVID-19. And last year we were resuming that. So we started sending out the renewal packets in April of last year. June was the first month. People that had a renewal due on June 30th was kind of the first group of people who had to start filling out those packets. So one of the biggest obstacles is kind of through kind of a very thick packet of papers. What should I fill out? What information should I actually update? It may be very confusing for our members who are doing it for this first time, and even our members who've been in the program because of how the questions are asked. So kind of throughout the process, we learned how to create kind of educational and training materials because we know our members probably interact with their doctors, sometimes their managed care plans, or individuals or health enrollment navigators out in the field that may be able to help them. So we created quite a few of educational videos as well as just kind of how-tos in all the Medi-Cal threshold languages, which is there's 19 of them, translated it and made sure that those things were shared in the community to help guide our Medi-Cal members in terms of filling it out and where to return the packet. And even just sharing how there are multiple ways you could actually do your renewal online, on the phone, etc. So that was definitely one of the kind of the top challenges that we definitely faced in the early months of the unwinding.
One more question. If people were disenrolled, how can they re-enroll if they're really eligible? And can you explain the 3 months grace period?
Yeah. So if you were disenrolled because you did not return your packet, you probably will have gotten a notice from the county. And usually what happens is there is a 90 days after that due date. So for example, your renewal was due to the county on April 30th of this year because you did not return it or you just had trouble filling it out and it's past the deadline and you're in May. You have 90 days from April 30th, so May, June, and July, within those 90 days to kind of complete the packet, send it back to the county, whether it be you could take it to the lobby, you could call it in, you could do it online. And within the 90 days, if the county will process your Medi-Cal renewal, and what's going to happen is your coverage for Medi-Cal will be reinstated back to the date of discontinuance, meaning that if you provide all the necessary verifications within those 3 months, you will regain your Medi-Cal without an actual gap in coverage, meaning that you won't start, say, for example, in June without a month of coverage in May. Your coverage will begin kind of restart again automatically without a disconnected gap.
Okay, that's good. But I'm curious, for example, if I lost my coverage and I actually do qualify and I have health problems during the time that I haven't been able to have coverage and then I regain it again. How do I go about, I mean, imagine that, I don't know, I had to spend money on clinics or something in the meantime. Is there any protection regarding that?
We do have a beneficiary reimbursement process in that very scenario. If you had to pay out of pocket, for example, the Department of Healthcare Services, we do have what we call a Conlon reimbursement process because technically once you get reinstated, your Medi-Cal will pay for those bills and you'll get reimbursed. So you have to make sure if that does happen and you do pay out of pocket, make sure you keep all the receipts of those expenses. And then there is a process that we can share here where you can get that reimbursement.
That's really great information that I don't think a lot of people know. So I'm glad we're doing this today.
Of course.
Ms. Huang, can you stay with us? I'm going to move on to the next speakers.
Yes.
Thank you so much. Our next speaker is Vilma Champion, who directs managed care and enrollment at the Northeast Valley Health Corporation in the San Fernando Valley of Los Angeles. Ms. Champion will share her remarks with Griselda, a medical enrollee at her clinic, and I can provide translation or interpretation for Griselda. Go
Great.
ahead.
Thank you so much, Pilar, for inviting us today. So good morning. My name is Vilma Champion, and I am the Director of Managed Care and Enrollment for Northeast Valley Health Corporation, NEVHC, a federally qualified health center providing primary care services to the San Fernando and Santa Clarita Valleys in Los Angeles County for over 50 years. And we are one of over 60 member clinics of the Community Clinic Association of LA, CCLAC, whose focus is to empower health centers to remain at the forefront of healthcare transformation, promote health equity, and advocate for the communities we serve. CCLAC has been an essential partner in advocating on behalf of its member clinics throughout the Medi-Cal continuous coverage unwinding period. At NEVHC, I oversee a department of over 40 certified enrollment counselors who assist our patients in our community enroll into Medi-Cal or Covered California, and who have been focused this past year on keeping Medi-Cal members enrolled during the redetermination process. Medi-Cal is becoming a vital program for the health and well-being of the communities we serve now that it has expanded coverage to the 26 to 49 adults, regardless of their citizenship and immigration status, getting us closer to healthcare for all. It's providing a new level of accessibility to quality and comprehensive healthcare services through the CalAIM initiative through Medi-Cal to meet the complex needs and social needs of its beneficiaries with the availability of enhanced care management and community support services. At NEVHC, we expect to provide primary and preventative services to over 6,000 newly eligible Medi-Cal patients who will have access to a network of private specialists and hospitals. Since the inception of the unwinding period, NEVHC has assisted over 5,000 patients in submitting their renewal packets and have focused on communication strategies. The outreach strategies utilized to educate the community about the redetermination process and the newly Medi-Cal eligible population has been through the resources made available by DHCS toolkits, where messaging, printed materials, graphics, and videos are available for our use. We communicate these important messages via the use of social media outlets, targeted outreach campaigns using text messaging, and on-site renewal redetermination events to help our patients submit their renewal packets to retain Medi-Cal benefits. NEVHC has prioritized outreach to Spanish-speaking and immigrant communities by employing culturally sensitive, not only because the bulk of our patient base is monolingual and from migrant immigrant backgrounds, but because we have come to understand that to most effectively reach our base, we need to meet them where they are and address their concerns in real time. This outreach includes bilingual materials and staff, outreach events and community, and partnering with trusted community leaders. Communicating effectively with Latino and Spanish-speaking communities involves navigating several challenges, especially when considering access and immigration concerns. We certainly have had our challenges assisting our community retain their benefits, but also so many lessons learned in keeping our patients enrolled, especially since Medi-Cal renewals is an annual process. Some recommendations that Northeast Valley Health Corporation would have is to establish a time frame in which renewals should be processed once received, establish a time frame in which cases are reinstated during the 90-day cure period once all required docs are received, add function to ensure eligibility workers are alerted when documents are uploaded to the case via Benefits Cal, and provide additional support to eligibility workers who have difficulty navigating the system, and reintroduce Saturday hours to increase accessibility and potentially reduce wait times when accessing the renewal helpline. I am very pleased to work with a dedicated and compassionate team of enrollers whose priority is to help our patients with the redetermination process and the retention of benefits. I would like to introduce one of our patients, Griselda, who will share her experience with the redetermination process and how retaining Medi-Cal coverage has impacted her and her family. Griselda?
Adelante.
Buenos días a todos. Mi nombre es Griselda de Jesús. Y
Griselda, voy a ir interpretando lo que vas diciendo, entonces ve como por frases para que yo te pueda ir interpretando, ¿ok?
ok. Soy mamá de 3 hijos y la experiencia que he tenido de tener acerca del servicio de que me ayudaron a renovar mi Medi-Cal, la verdad que siempre en esta oficina de aquí en el área de San Valley, siempre están muy atentas las muchachas ayudándonos a todos para a cualquier duda que tengamos si queremos tramitar Medi-Cal o querer continuar en Medi-Cal.
Okay, my name is Griselda. I'm the mother of three children. And the experience that I've had with this service that provides help for us to keep our Medi-Cal has been really great, especially in the area where I am in Sun Valley. I see that the ladies at the office are always reaching out to us and helping us with any problems we could have with Medi-Cal.
Y otra cosa también que yo he visto que cuando hemos pedido ayuda ahí, siempre hemos tenido la respuesta más pronto que cuando lo hemos hecho directamente en las oficinas o incluso también en línea, porque a veces yo he tratado de hacerlo en línea y siempre hay mucha llamada de esperar mucho tiempo y aquí con ellas yo sé que las consideran más rápido. Por eso es que me gusta ir ahí con ellas.
Okay, so the help that the clinic enrollment specialists have provided it just makes it faster than calling or even trying to get help online from the Medi-Cal offices. I think that it's easier for us to just go through these workers. Yes, adelante, Cristina.
Y uno de los mayores beneficios que me ha gustado de tener Medi-Cal es que yo he tenido la oportunidad de que a mis hijos su físico de cada año se lo llevo al corriente y eso me da a mí la seguridad de que cualquier cambio de salud que ellos tengan, yo pueda tomar acción para prevenir. Entonces es uno de los mayores beneficios que yo tengo, incluso cuando una operación de aneurismas, el Medi-Cal de emergencia que nos dan a nosotros me ayudó. La verdad que yo estoy muy agradecida con el Medi-Cal por todos los beneficios que tenemos.
¿Quién tuvo la operación, Griselda?
Yo.
¿Tú? Okay. I'm always keeping on my children's physicals every year, and it was very helpful to just be able to keep my Medi-Cal in order to stay up to date with that. And also, I had to have an operation because of an aneurysm, and everything went smoothly. So I'm thankful for that too. Adelante, Griselda.
Y también otra de las cosas que nos da el beneficio, si nos hemos beneficiado durante mucho tiempo, es el asistir a los dentistas con mis hijos. Porque una de las cosas que aquí, es de las cosas más caras que podría uno, si no tuviéramos el Medi-Cal, se tendría que pagar. Entonces también ese es uno de los beneficios que me ha gustado mucho de tener Medi-Cal. Y como mi niña de 15 años tuvo un problema de dentadura, ella tenía los dientes que no podía sellar bien su boca y el Medi-Cal le autorizó sus braces. Y cuestiones de esos es importante porque los niños cuando no podemos pagárselos, a veces sufren bullying en las escuelas por los defectos que ellos tienen físicos. Y eso me ayudó a mí a que ella ahora esté más segura en toda su escuela.
Muy importante, gracias, Griselda. She says that one thing that she loves is that she and her children have access to dental help, dental work. And that is normally a very expensive service, as we all know. She has a daughter who's 15 years old, and she had a problem with her teeth that she couldn't close her teeth. And she was afraid and aware of the fact that kids who have these apparent defects suffer bullying in school. So she was very happy to be able to get her braces and to prevent that from happening. Adelante, Griselda.
Pues me gustaría hacer una lista grandísima de todos los beneficios y agradecimientos a las personas que nos ayudan, pero pues tenemos poco tiempo. Yo espero que mi opinión sea que sí les haya gustado. La verdad que yo sí estoy agradecida de tener Medi-Cal. Y es todo, les agradezco por su atención y haberme invitado a escuchar todos los beneficios y cómo se enrola la gente año con año dentro de Medi-Cal.
Muy bueno tu testimonio, Griselda. Muchísimas gracias por compartir tu historia. Es muy útil para todas las personas que nos escuchan. Y bueno, muchas gracias. Voy a volver a Vilma a hacerle una pregunta. Muchas gracias, Griselda. Vilma, so, we know that having people at the clinics to help process re-enrollment is great. But can you give us an idea of what happens in places that don't have, like rural areas or smaller clinics that really are understaffed, that don't have that kind of help? And also for Ginger, if you want to add something to that.
Yes, I know it would be more difficult for the rural areas to receive assistance and have the certified enrollment counselors available to assist with troubleshooting or any issues that they may come across in the renewal process. But I know that DHCS is also available to assist and connecting them, because they have valuable resources that we've been using, like Keep Your Community Covered and videos and training materials to assist and direct the community how to access those resources and assistance.
Thank you. Ms. Huang?
Yeah, thank you, Vilma. I was just going to share exactly that. We have been actually looking at a lot of our data through like paid media, all the campaigns that we have done, just looking at it from like low return rates on renewal packets, for example, and really trying to kind of target those areas quite a bit just from, data that we were able to see. And secondly, knowing that we do actually have a health enrollment navigators funding kind of throughout the state, in addition to enrollment navigation for like health clinics to really help a lot of the rural communities. We've been kind of, that is a new investment this year that we have made to these health clinics kind of outstationed in kind of rural communities to help. But for sure, we rely on our community partners. And as Vilma was sharing, if we do know there is some assistance we can give, we could keep kind of providing kind of direct assistance to that area as well, and hoping that many of our kind of outreach materials through videos as well as like toolkits and how-to guides that's been translated would be helpful in those areas, and kind of looking to our community partners to help us push that message.
Thank you so much. That's very helpful. Thank you both, Vilma and Dingia, and of course, Griselda again. We're going to move on to our next speaker, and that is Fitzgerald Gray with the African American Network of Bakersfield. He's going to share about the importance of enrollment in Medi-Cal for himself and his family, and his experience doing that. Mr. Graves, please go ahead.
Greetings, everyone. Thank you for having me. First, let me start. I'm, of course, a recent grad from Cal State Bakersfield, major in psychology. I don't want to get too over analytical, so pause me if I go too fast. One of the challenges that I noticed, well, not so much as for me, but my family, they originally or previously had HealthNet. And so, as you know, HealthNet has been disbanded. And so everyone's moving into other forms of coverage. Well, that option for me and my family was Kern Family. And so I was already enrolled. But one of the things that was like very, consistent was the, I guess, lack of access to people that to help you walk you through it. But one of the other things is that they did send out a letter, but that was after the fact. So we attempted to call in several times. The wait was quite long. And sometimes you got disconnected, or they would call you and you would either be driving or something, and you couldn't really go through the process of re-enrolling over the phone. When I tried to do it online, again, you have to have a lot of information to provide, but most of this information we had already provided to DHS. So I will say this: we did have eventually we did have a worker that assisted us, but tragically it was after we had experienced a very deep loss. So my daughter Kiara had became pregnant. She was fairly young. She made the decision to have the baby, but she didn't have adequate medical or access to medical care. She didn't know how to navigate it. And at the time she was trying to be this adult, and she just didn't know where to go. And I would try to get someone to assist her. I gave her a number, we called together, and it just became, pretty much undoable. So when we got through, we were able to get her information verified and get her enrolled, but then we didn't have a specific doctor chosen. So we kept having to go to different Omni clinics. And she expressed to me her concern about going through this because she felt like there wasn't any real rapport built with these doctors. And this is a big major event in her life. And she didn't get the various prescriptions that she needed for a healthy child caring. I'm sorry.
Pregnancy.
So on January 31st of last year, we lost our grandson. Turned out he had, I don't want to enunciate the disease wrong, but the top of his head hadn't fully filled in. And so we went to the downtown hospital. And while we were there, the doctor there, again, no relationship, no rapport, emergency situation. He misdiagnosed her. He, basically said the heartbeat, but the baby was fine. And he just wasn't professional. He actually cursed us. And so what I learned from that is that you have to have a doctor on call for her specifically that she's familiar with. If not, someone that can advocate strongly against these type of occurrences. So to make a long story short, we go to the second hospital where they do labor delivery. What we found out is that downtown didn't do that. So when we got to the other hospital, they informed us that there was no heartbeat and that the baby had passed at least the day before. And so she screamed, I screamed, we cried. And we've basically been trying to manage everything since then. But what it did do was motivate me to get clarity on the coverage. We actually sought out physicians once we were enrolled. But I think that my story is important because had we had the clarity that we had coverage, she probably would not have went to Omni. She would have selected a specific gynecologist or someone who had accepted health net. But that wasn't the case. And so because of that, she had an inkling that there was something wrong with our grandson, but without that constant medical check-in, she was unable to verify exactly completely what was going on, or if this was something that was unavoidable. But we found out later on that it was something unavoidable, that this was due to a lack of amino acid. I believe it was the folic acid, one of the two, folic acid, and that he had encephalitis, and that he had not developed because of that lack of that nutrient. So we were able to eventually get all of us onto Kern Family, and I'm happy to say that she and her fiance are expecting a little girl. I've tried to get her to use this new enrollment as a tool to get therapy and counseling. But again, we're operating with very little insight detail as to, because what happens, you get these thick manuals and you're going through the manuals and you're trying to select the person. But I think what would be better if there was a person who kind of knows these physicians and can meet with the younger enrollees and now have a system in navigating, because I don't know all of the, ins and outs and who the best physicians are. I know that I have a relatively good one now, or have had, and she started to accept them, but because they had health net, they couldn't. But now they have Kern Family, she can. And so I said all that to say that it's important that individuals who are enrolled know what all their benefits are, understand how to access those benefits, but also having an advocate to speak to directly when they feel that they're being treated less than. And I felt that when my daughter and I showed up at that hospital that day we lost Azariah, the physician had it's like as soon as they seen Health Net or, Medi-Cal, it's like the demeanor changes. It's almost like you get a subpar treatment because you have this state recognized insurance. When in actuality, I believe that Medi-Cal stretches like way across way more services than other insurances. And so with that, I digress. I'm sorry. I really thought I was going to be able to, kind of talk about it a little better, but I'm really kind of
I
reliving
think
that moment.
I think you conveyed the anguish that you went through. And I think that's where you were when you were speaking about it. So it's okay. It's okay. Well, I'm gonna ask Chinja and Vilma to give advice. What happened here and what's your advice? Maybe Chinja first.
Yeah, I'm so sorry for your loss, Mr. Graves. I think for sure, I think we were undergoing a statewide managed care transition. As you were sharing, HealthNet no longer was available in Kern County, and the option was for the family to move into a Kern Family Health. And I think in general, I think there is definitely, you said it well, there is definitely more education to do statewide for the provider community, regardless of the type of insurance you have. Medi-Cal, we have a very full suite of services available, and all our members should be served with dignity regardless. And secondly, I think there is more to be done, definitely from our end, as well as, with kind of all the touch points with our members, whether it be the provider community or the health plans, to do a better job in terms of really sharing information in a more simplified way so our members understand here are all the available options to us and for you to actually make an informed choice. And I think there's definitely more work that can be done on our end to make sure that happens. So thank you for sharing your story.
Thank you. Vilma, any advice? You're unmuted.
Yes, I'm so sorry for your loss, Mr. Graves, but as a provider, yes, definitely making sure that our team, our care teams, our work closely, our doctors and our nurses, along with my department teams, like the enrollment navigators too, to make sure that we provide you with all the information that's available, all the services that are available in the Medi-Cal program, and connect you with the services that you need in a timely fashion, whether that's, addressing or referring you to specialty services or hospital services, but working as a team and coordinating those services so that services are rendered in a timely fashion.
Mr. Graves, now I think your whole family is in full
Yes.
stop Medi-Cal. How do you feel now about your situation? Is it a little better?
So I would say that my daughter is more confident in carrying her child at this point because she's had regular medical appointments. She has a designated doctor that she sees, and she's more educated. And she realizes that she has to advocate strongly for herself and not let anyone minimize the care she needs. And I think one of the other profound things that we recognize is that it's really hard to get a second opinion or a referral for a second opinion in some cases because you're limited by the referral. And I'm not saying that's a negative off the cuff, but I'm saying that so for instance, I'm scheduled for knee surgery due to a car accident, and I'm leery of it because of how long it took me to recover from a previous knee surgery. And so when you're going through that and you can't do any type of work, you don't qualify for certain things. And it's just it's you have to wait longer is what I'm saying. You have to postpone these procedures so that you don't put yourself in a greater deficit. And so I would think that sometimes when you can get a second opinion, they can say, hey, well, this may be the case, but you can do A, B, and C. Or if you have to wait for the surgery, it'll be 4 months, but in the meanwhile, here's something you can do to offset the loss or whatever. And I just feel like so many times, because when you say Medi-Cal or covered California, people assume that you're receiving assistance. And in most cases, some of us are, because that's what the society, I mean, it's really hard to make it anyway, if you're full-time or not. And so I just, the stigma of having Medi-Cal sometimes is very apparent in others. And so when you're trying to get the service and the treatment you need, you sometimes feel like, will they care? Will they give me the top treatment? And so if you had that second opinion, then you could compare the information, and then you could say, oh yes, they're treating me similar. This must be the way to go. Thank you.
Got it. No, absolutely. And we understand you're having surgery soon. And how do you feel you feel better about that? Just short.
Yeah, I mean, I believe that the physician or the surgeon who I've been speaking with, he's very competent. The team I was with previously with Dr. Chandra. And so I'm confident that they can do the surgery. It's just what happens once I have it, and like how long will I get to go to recovery? Will I have the rehab to get me back to coaching? And like, because that's a big part of it. Because if in some cases when you have insurance that only covers the surgical part of it and then the medical stay, but then the rehab after is vital, because that determines how fast you're back on your feet. It also determines if you're going to have blood clot issues or infections or all those things. So you need that follow-up ready to be rendered, so you don't have to guess what you're doing next.
Thank you, Mr. Graves. We need to move on now. Thank you so much. But before I move on, I wanted to ask Ginger about expanded coverage or expanded Medi-Cal. Can you talk a little bit about that?
Yeah, so we did expand Medi-Cal to individuals 26 through 49 on January of 2024, and we refer to them as the adult expansion. And this group of individuals, about 700,000 individuals, were previously in 2023 with what we call limited Medi-Cal, where we only cover emergency and pregnancy-related services due to immigration status.
Excuse me a minute. I was talking about expanded managed care and community supports that the Medi-Cal in California is implementing.
So the enhanced community ECM, enhanced care management, as well as community supports are fully implemented across the state. My team can plug in the link to the type of services into the chat. And right now, all the managed care plans, with California being a managed care state, do offer what we call these community support services. And it really is to help with kind of the care coordination, as what Mr. Graves was sharing. A lot of these kind of gaps in terms of it shouldn't be provider A and provider B not talking. There should be a lot of care coordination, bridging the different types of care. So it's something that is new, that we started about a year or so ago, hoping to further expand our efforts through outreach and also more provider and health plan training.
Well, that's great, because after his operation, he will have access to enhanced community supports. Clearly, he and all the people in his in position would need it. But we need to move ahead and go to our next speaker. Thank you so much, Mr. Graves, and thank you so much, Ginger. We now are going to hear from Dara Montejo, and we have her over video. She wasn't able to be with us today, but she's the daughter of a newly enrolled undocumented mother, and she's going to talk about how Medi-Cal has transformed her access to healthcare and the well-being of her family. Please roll the video.
Hi, my name is Dara Montejo. I am 20 years old. I am part of a family of 4, including my mom, my 2 siblings. One is 12 years old and one is 8 years old. My mom is from Yucatan. I see myself as a Yucateca mainly, and which is part of Mexico. Last year in August, we happened to be by Escondido near San Diego in our way, and she had her first seizure. She's never had that. I've never seen one in my life. So I really thought my mom was dying. And I don't really know much about Medi-Cal during that time, or, for example, like the restrictions or like rules of how Medi-Cal works during an emergency, especially given that my mom is undocumented. So during that time, calling the ambulance, I was like, although my focus was all on my mom, in the back of my mind, I was like, I don't know how much the bill is going to be, right? In that situation, I was thinking like, oh my God, like I know the bill's going to be really high. And once the EMT people came by and asked if I was giving permission for them to take my mom through the ambulance, we were like, no, because we don't know how much that's going to cost, especially since we're not in San Francisco and we don't know how much it costs around here. So with all of the fear and everything that was happening, we decided to take my mom like in my dad's car. So I wasn't feeling very safe taking my mom in the car, but that was like literally the only option I felt in that moment that I had. And it was just very scary to like have to take my mom in a car, take her to an unknown hospital, and not knowing how much the bill was going to come out at the end of the day, you know? Yeah, so that was the situation in August. So now, since I know that in January 1st, Medi-Cal had new rules or opened its arms to different resources to the undocumented population. And right now, my mom is able to go to general. I told her whenever she feels bad in any type of way, I told her go to the emergency room, you know, knowing that by her having Medi-Cal, she has access to the emergency services. So I'm not scared of telling her, just go to the emergency room, because I know that we won't get like a bill of 1,000 or more, you know? And she's able to access to her prescription. The prescriptions are not cheap at all. I've read how much they are, and like each bottle is over $100. And we're supposed to be getting these pills every month. So imagine having to pay all of that, and it's not even one pill, it's like 3 different pills. So I'm just grateful that my mom is able to qualify for Medi-Cal and have access to these treatments, the CT scans, the pills, that I'm not scared of calling 911 and requesting an ambulance. Yeah, so it feels nice to not have to worry about that, especially when I'm not certified to taking care of my mom when she's having the seizure. So yeah, having that access is really nice.
All right, well, thank you to Dara for her testimony. So I wanted to know, Ginger and first, and then Vilma, how has the expansion to the undocumented adult population gone? I understand that you were going to just switch over people from the emergency Medicare or smaller scope, I can't remember what the technical term is, to the full scope, right? So, but how has it gone in terms of people actually using the service? I've talked to people who didn't know that they had been transferred. So, how has that gone, Ms. Wong?
Yeah, so I think overall, we will be releasing some information on this in a couple months. We started new enrollments in January, and we know through some of the data we are seeing that there are thousands of individuals that are joining the program. We actually won't be able to see if they've accessed the services yet. It's still quite early to understand what we call utilization, and we'll take a look at that as we have more months of experience. But from the past, I think just learning from our experiences, expanding coverage to adults that are 50 plus, our children under 19, we are seeing utilization because of all the preventative services that's added through kind of the full suite of services. We're seeing less utilization in emergency rooms, for example, because now they have more access to, they could see the doctor on a pretty regular basis. And we hope that that will be a similar experience for our 26 through 49-year-old individuals that now are part of that full breadth of services. So as the months go by, upcoming, we will be kind of tracking to it to see kind of where we are.
Vilma?
Yes, we have certainly seen an influx of calls from brand new Medi-Cal patients wanting to access healthcare services. I run a member services department in my department, and we have seen certainly an increase of calls for us to schedule appointments, scheduling physical appointments, scheduling acute care services for sick appointments, for instance. But so we're happy to assist them and schedule them and connect them with services. So we're happy to see that they're accessing the care that they need.
Thank you. Griselda, ¿todavía estás allí? I'm going to try to ask a question from her. Griselda? Griselda, ¿estás allí todavía? She maybe had gone. Oh,
No,
hola. ¿Qué
estaba,
tal? Sí, tranquila, no hay problema. Quería preguntarte, en cuanto a la comunidad, tus amigos, tu familia, la gente que quizá ahora por primera vez está consciente de que puede tener cobertura, ¿qué has escuchado? ¿Qué piensas?
de que quieran enrolarse o de su opinión del
De
todo.
lo que sea. I'm asking her what she can share with us from her community, her family, her friends about Medi-Cal, whether or not they are enrolling, whether they need it or not. Sí, en general, cualquier cosa. ¿Qué piensan de esta expansión, de que está disponible, etcétera?
Oh, mira, yo he escuchado a mis amigas, la mayoría siempre se pone al corriente en tener su Medi-Cal. Una cosa que muchas veces pasa, digamos que cuando una persona somos distraídos, no ponemos atención en los paquetes que llegan, ¿verdad? Pero si uno tuviera el Medi-Cal constantemente mandando los reportes sin que dejáramos que se vencieran, yo creo que muchas emergencias, yo estaba escuchando los casos de ellos, posiblemente los procesos, sabemos que siempre en muchas cosas se tardan un poco. Pero si tuviéramos todo al corriente y estuviéramos hablando más en otras oficinas o buscando más apoyos, muchas cosas pudiéramos prevenir. Entonces, mis amigas, la mayoría yo voy al centro de padres de la escuela de mis hijos y de un porcentaje alto de padres, créame que solamente va el 20% de todos los estudiantes. Entonces, ¿quiénes son las personas que están siempre buscando estar bien o ayudar bien a sus hijos? Pues yo creo que debemos todos de buscar esa manera de enrolarnos con las escuelas, enrolarnos en la vida y en la comunidad para que podamos aportar algo. O si sabemos que alguien está yo en lo personal, si sé que alguien acaba de venir a este país y necesita, yo les digo, vayan y pregunten.
Déjame traducir esto, Griselda. Griselda shares something very, very important. She says that among her circle of friends, they are all always very, they always are watching, you know, what's happening. They're very aware of whatever the information they receive, and they look for ways to be informed. She feels that not everyone is the same. Not everyone, you know, some people are more, she called them distraídos, distracted, and they might, you know, they might lose eligibility because of it. And she feels that some parents in her parent center at her school really missed the chance to enroll because they weren't really paying attention to the news, and she herself has, you know, taken it onto herself to tell people about the services, and if she knows someone that's arriving, you know, in the area of California, and they don't have coverage, that she will take it upon herself to inform them. Gracias, muchas gracias, Griselda.
Gracias.
Okay, we are 4 minutes away. Okay, let's see. Let's have a last question for everyone before we close. How do you all view the future of healthcare in California, the future of Medi-Cal? Are we headed towards a more health for all system that would be simpler, centralized at some point, instead of having to like do all these enrollments and re-enrollments, and you know, the way it is maybe in other countries? Chinja.
No, thank you for the question. Yes, I think in general you summarized it well. I think we are positioning ourselves, the department statewide, to look at a more coordinated system of care. And I think not only from just eligibility process, applying for Medi-Cal, renewing Medi-Cal, we learned a lot from unwinding. Lots of outreach. We're going to continue that. We've learned how to talk to our members better, know kind of what helps with the process. And from a care perspective, we are transforming in terms of the increased number of services we're providing, and we'll learn kind of throughout kind of the next couple of years how to do a better job. But that's kind of the direction we're moving towards.
Thank you so much. Vilma?
Yes, and I just would like to add that, yes, Medi-Cal is definitely playing a very important role in California and in the healthcare system. And I think we are moving towards universal healthcare coverage. But as we expand the accessibility of Medi-Cal, we want to make sure that the community is accessing healthcare services, that we are reaching out to our patients, encouraging to schedule that preventive service, not to wait until they feel sick to access care. I think that's extremely important, you know, making sure that they stay healthy, come in and schedule their preventive services, have their health screenings, the important health screenings to prevent illness. So again, encourage, now that they do have access to insurance, to access those services on a regular basis to stay healthy.
Thank you. Mr. Graves, what's your hope for the future of healthcare in California?
Mainly that we just, you know, continue that, like she was saying, doing the outreach, make sure the language is understandable at its basic level, but also the follow-ups that make, you know, the difference after the services. And I'm sure that's going to get better anyway. But my also question was, how do the team members feel that AI will impact, you know, treatment? Because a lot of services or providers have these automated systems and everything's done online, and you don't get to meet or talk to a person until you're at the office. So
yeah, that is actually a great topic for another whole briefing on that. Thank you so much, Mr. Graves. Griselda, ¿estás por ahí todavía para que te despidas y nos digas algo más? Te voy a preguntar. I think, Griselda, la última cosita, Griselda. Entonces, viendo esto que está pasando con Medi-Cal, ¿cuál es tu esperanza para el futuro? What's your hope for the future of healthcare?
Pues muchas personas dicen que a lo mejor ya no va a haber Medi-Cal, pero pues esperemos que sí continúe, porque tal vez a los que ya estamos de edad avanzada, pues a lo mejor nos morimos pronto, lo sabemos, pero faltan los niños y ellos, si no tienen lo económico, ¿quién los va a tomar su cuidado de su salud?
Sí.
Entonces yo espero pues que siga estando las ayudas del Medi-Cal y pues que las comunidades, toda la gente que no sepa que puede agarrar un Medi-Cal de emergencia o un apoyo, ¿cómo se llaman los programas de salud? Gustaría que sí se pusieran a investigar, porque yo conozco gente que no sabe que sí existe ayuda para ellos.
Claro.
Y yo mando a las clínicas, le digo, va a tal clínica o ve, llama a tal lugar, porque pues es importante para que uno se mantenga bien.
Sí, gracias, Griselda. No todo el mundo es tan movido como tú.
Ahí no, es que
Okay, so she's tenemos que cortar porque se acaba la hora. But what she's saying is that she hopes medical lasts forever, and or at least, you know, some good coverage lasts forever. It's in the future for our kids, and that people really find out about these opportunities and they pay attention, and you know, Griselda was saying, I'm always on top of it. Well, I said, not everyone's the same. But she seems to be an activist in her community. So thank you everyone for this very important briefing and this important information and your testimony. And we really appreciate it at Ethnic Media Services. Thank you so much.